intro music. Hello and welcome. Today, we're diving into a common yet often distressing condition affecting the urinary system, bladder clot retention. This occurs when blood clots accumulate in the bladder, preventing the normal passage of urine. We'll explore the causes, symptoms, diagnosis, treatment, and more. Understanding bladder clot retention is crucial for timely intervention and better patient outcomes. Let's get started. So, what causes bladder clot retention? The most common culprit is bleeding within the urinary tract. This bleeding can stem from several factors, including prostate enlargement. An enlarged prostate can compress the urethra, leading to irritation and bleeding. Bladder cancer. Tumors in the bladder can erode blood vessels. Urinary tract infections, UTIs. Severe infections can damage the bladder lining. Trauma injuries to the bladder or surrounding areas can cause bleeding. Recent surgery. Procedures involving the bladder or prostate can sometimes lead to post-operative bleeding. Radiation therapy. Radiation to the pelvic region can damage blood vessels in the bladder. Blood thinners. Medications like warfarin or aspirin can increase the risk of bleeding. Certain medical conditions. Conditions like bleeding disorders can predispose individuals to bladder bleeding. Now let's delve into the pathophysiology. When bleeding occurs in the bladder, the blood begins to clot. These clots can range in size from small specks to large masses. The bladder's natural emptying mechanism relies on smooth muscle contractions to expel urine. However, large blood clots obstruct the flow of urine from the bladder, leading to retention. The bladder becomes distended and unable to fully empty. This distension can significant discomfort and, if left untreated, can lead to serious complications like kidney damage. The longer the clots remain in the bladder, the more difficult it becomes for the body to naturally break them down and expel them. Unfortunately, precise data on the exact epidemiology of bladder clot retention is somewhat limited. It's often reported as a complication of other underlying conditions. We do know it's more common in older men, due to the higher prevalence of BPH and prostate cancer. Individuals with a history of bladder cancer or urinary tract surgery, patients on anticoagulation therapy, those with recurrent UTIs. The overall incidence is likely underestimated as some cases may resolve spontaneously or be managed in outpatient settings. Recognizing the signs and symptoms is key to prompt treatment. Common symptoms of bladder clot retention include inability to urinate. This is the hallmark symptom. Painful urination. Even if some urine is passed, it may be accompanied by pain or burning. Lower abdominal pain or pressure. Due to the distended bladder, blood in the urine hematuria. This may be visible or microscopic. The urine might appear pink-red or even dark brown with clots. Frequent urination. In some cases, the bladder may try to empty itself frequently, but only small amounts of urine are passed. Feeling of incomplete emptying. Even after urinating, you may feel like your bladder is still full. Urinary urgency. A sudden and intense need to urinate. It's important to note that the severity of these symptoms can vary depending on the amount of blood clotting and the degree of obstruction. Diagnosing bladder clot retention typically involves a combination of physical examination, urine tests, and imaging studies. Physical examination. The doctor will assess for abdominal distension and tenderness. Urinalysis. This test detects the presence of blood and other abnormalities in the urine. Blood tests. These can help assess kidney function and identify any underlying bleeding disorders. Ultrasound. This non-invasive imaging technique can visualize the bladder and detect the presence of clots. Cystoscopy. A thin flexible tube with a camera is inserted into the bladder to directly visualize the lining and identify the source of bleeding. CT scan. In some cases, a CT scan may be necessary to rule out other causes of abdominal pain or urinary problems. Bladder clot retention doesn't typically have strict classifications or types in the same way as some other diseases. However, it can be categorized based on severity, moderate or severe, depending on the degree of obstruction and the amount of blood clots. Underlying causes. As we discussed earlier, the cause could be BPH, cancer, infection, trauma. Identifying the root cause is essential for proper management. Acute vs. chronic. Acute retention develops suddenly, while chronic retention develops gradually over time. Chronic retention is often associated with incomplete bladder emptying and can lead to complications like UTIs and kidney problems. The primary goals of treatment are to remove the blood clots, stop the bleeding, and prevent recurrence. Treatment options may include a catheterization. A urinary catheter is inserted into the bladder to drain urine and remove blood clots. Bladder irrigation. A sterile solution is used to flush out the bladder and break up blood clots. This is often done continuously through the catheter. Cystoscopy with clot evacuation. A cystoscope is used to directly visualize and remove blood clots from the bladder. Medications, depending on the underlying cause. Medications may be prescribed to control bleeding, treat infection, or shrink the prostate. For instance, antibiotics for UTIs or alpha blockers and 5-alpha reductase inhibitors for BPH. Surgery in severe cases. Surgery may be necessary to remove large clots or treat the underlying cause of bleeding, such as bladder cancer or an enlarged prostate. Addressing the causa, it's vital to treat the underlying condition, like BPH or bladder cancer, to prevent future episodes of clot retention. While it's not always possible to prevent bladder clot retention, there are steps you can take to reduce your risk. Treat underlying conditions. Managing conditions like BP and UTIs can help prevent bleeding. Stay hydrated. Drinking plenty of fluids can help prevent blood clots from forming in the bladder. Monitor your medications. If you are taking blood thinners, talk to your doctor about the risks and benefits. Ensure you are taking them as prescribed. Avoid bladder irritants. Limit your intake of caffeine and alcohol, which can irritate the bladder. Quit smoking. Smoking can increase the risk of bladder cancer and other urinary problems. Regular check-ups. Regular check-ups with your doctor can help detect and treat urinary problems early. The prognosis for bladder clot retention depends largely on the underlying cause and the promptness of treatment. With timely intervention, most patients recover well. However, recurrent episodes can lead to complications such as urinary tract infections, kidney damage, bladder dysfunction. Research is ongoing to develop new and improved methods for preventing and treating bladder clot retention. Some promising areas of research include new medications to control bleeding in the urinary tract, minimally invasive surgical techniques for removing blood clots, better understanding of the risk factors for bladder clot retention. Advancements in these areas hold promise for improving the long-term outcomes for patients with this condition. The outro music.